Hi, I'm Dr. Joe Niamtu, lovethatface.com. Wow, thank you. That's totally unnecessary. And thanks so much for watching our channel. If you follow our channel, you know that I do cosmetic facial surgery in Richmond, Virginia, and you know that I'm passionate about this. I love coming to work, and it's Monday morning. When I went to bed last night on Sunday, I was pumped up that I was going to come in and do a facelift. So face and neck lift surgery is kind of my signature procedure, and I've done almost 1,300 of them. And so I really enjoy talking about this, and we have an international audience, and I get a lot of questions, about some of the myths of facelift surgery. So one of the things that somebody asked recently is, why do you see so many people with unnatural looking facelifts? And that's a great question, because just the word facelift is scary to some people, because you see people walking around that look so unnatural. And really, the key to doing cosmetic surgery should whisper and not scream, all right? And it should be subtle and look natural. So there's two things that we have to do when we do cosmetic facial surgery. Number one, it has to be safe. You have to have a safe environment, a safe surgery center, a safe surgeon, staff, sterilization, and everything. Number two, you have to have a natural outcome, all right? I always tell patients, it's your face, it's my reputation. So, we both have to be satisfied here. So why do you see so many unnatural people walking around with facelifts? Well, it has a lot to do with multiple factors, including the surgeon, the type of procedure that was performed. So some people look unnatural because they've had 6 facelifts. Other people look unnatural because they had the wrong type of facelift, or they had the wrong surgeon. So it's real common when patients come in and they say, hey doc, I don't want a full facelift, I just want a little bit of this. Okay, well really you don't want a little bit of that, so that would look very unnatural. However, this, okay, is probably more natural. And if you've watched my videos, you've heard me say a lot of times that a facelift is a procedure from here to here, and it doesn't do anything in here. Okay, so it doesn't help your forehead, your eyes, your nose, your mouth. And if you try and make it do something in those areas, that's when you get these really creepy looks where you have pulled mouths and pulled eyes. Okay, so when I do a lot of teaching, and if I have an observer or a young surgeon, and when we're pulling the skin, as I'll show you on a diagram here, the vector of aging is really forward and down, okay? That's why we get all this. And the corrective vector needs to be backward and up, or superior lateral. And if you pull the wrong way, you're just going to have a distorted facial anatomy. So it's very important that the surgeon understand how to do this. And you think it would be pretty simple, but obviously you see a lot of people walking around with poorly performed facelifts. So number one is the surgeon and his or her experience, all right? The other thing is, what type of lift are they doing? So it's very trendy in this day and age to see all these miracle facelifts. They're medical breakthroughs, and you can drive to the office and drive home and no bandages and a 3-day recovery, and you do it awake. I always say, beware of any facelift that's called anything but a facelift, because you can go online and there's this facelift and that facelift, and doctors that name facelift after themselves, or these trendy names. Forget about it, okay? A facelift hasn't changed that much in a century in terms of kind of the basics of the operation. And you get what you pay for, not in money, okay, but in recovery, all right? So something that, no incisions and heals in 3 days, that's just not going to do much, and it's not going to last long. Now, short scar facelifts, which are the kinds of lifts that just have the front incision, that's less than 2% of my facelifts, and that may be fine for somebody that's 43, but if you do a shortcut procedure, pretty much you're going to get a shortcut result. And that's either going to be in the way it looks, natural or unnatural, or how long it lasts or doesn't last, okay? So, I have a whole video about a full facelift. People come in, do I need a full facelift? So I call it a traditional facelift or comprehensive lift. And it's a balanced facelift because it addresses all layers of the skin, the outer layer, the middle layer, the deep layer. It addresses the fat, it addresses the muscle, it addresses the SMAS. And this is very important. So when I do a facelift, I do an incision under here and do the platysmoplasty, which I have other videos on. And of course, I do the incisions in front of and behind the ear and in the sideburn. And you really have to do those types of incisions to be able to move everything in the correct vector or direction that it's supposed to be moved. Now, what the surgeon does under the facelift is very important as well. So you have to address the SMAS, and that is the superficial musculoaponeurotic system, and that's kind of the deep layer, muscle layer of a facelift. I prefer doing a SMASectomy. It's worked very well in my hands. I've not had significant problems at all with nerve damage or anything like that, and the longevity has been great in my hands, and it lasts a long time. You should hopefully get 10 12 years or so out of a facelift, although I do have some patients I did 18 years ago, and they're just starting to get more aging. And but any surgeon will tell you that some people don't have great genetics, and they have very elastic skin, and they may need a touch up sooner than that. But doing the right procedure has so much to do with it. Now, there are deep plane SMAS facelifts, SMASectomy, SMAS plication. There's so many types of ways to do this, and it's really not important. Somebody will call and they say, well, I want a deep plane facelift. What's important is that the SMAS is being addressed, and it's being addressed in a way that that surgeon has had really good experience with safety and natural outcomes. For some people, it might be deep plane. For other doctors, it might be SMASectomy. It's really less important of what they're doing, as long as they're doing something and they do it well. So my point is, you want a safe facelift with a predictable outcome. You want it to look natural. You don't want it to look extreme. And I think the best patient is someone that comes in here and said, hey, Dr. Joe, I want to look as good as I can for my age. All right, and that's important, as opposed to somebody that comes in and wants to look like Elvis or Lady Gaga. You've got to be doing this for the right reasons. And again, I'm such a lucky guy that I get to do this for a living. So if you're looking for an experienced facelift surgeon, look for somebody who has done 1,000 facelifts or more. Look for somebody who can show you hundreds of before and after pictures so you can see their work. Look for somebody that is board certified in their specialty. Look for somebody who has an accredited surgery center. And, you have to find a doctor that you can talk to. I give all my patients my cell phone. I've always said, if you can't call your doctor, you chose the wrong doctor. So I'm Dr. Joe Niamtu, cosmetic facial surgeon in Richmond, Virginia, and there's no better gift than your time. Thank you so much. Coming to you live from lovethatface.com.